Rubella, the infection formerly known as the German measles, is caused by the rubella virus. Thanks to vaccination, it's a disease we see less and less, although because some groups are under-immunized, it's still possible to see outbreaks. The rubella virus is part of the Togaviridae family. Togaviruses are single-stranded RNA viruses surrounded by an icosahedral capsid, which is a spherical protein shell made up of about 20 equilateral triangular faces, all within a spherical outer lipid envelope. They're also positive sense RNA viruses, which means that their genetic material is actually mRNA, so it can be used right away by the host cell to make viral proteins. Now, the rubella virus is transmitted through respiratory droplets, which are released into the environment when you sneeze or cough on another person. Within the nasopharynx mucous membrane, the virus binds to a specific receptor on the membrane of epithelial cells. It's then surrounded by a little section of cell membrane that pinches off to form an endosome that's then brought into the cell. The low pH in the endosome uncoats the viral RNA, and the virus causes changes to the endosome. Now, when the rubella virus enters the cell, it also rearranges some of the organelles, gathering the endoplasmic reticulum, Golgi apparatus, and mitochondria around the endosome. The result is a membrane-bound viral replication complex where, like the name says, the virus replicates. So, after the virus replicates, its structural proteins are synthesized using the rough endoplasmic reticulum, and these proteins are then transported to the Golgi apparatus to be assembled and surrounded by the membrane, a process called viral budding. The new virus copy eventually exits the cell by exocytosis and enters nearby lymphatic and blood vessels, traveling to lymph nodes where it will replicate once again. From the lymph nodes, it enters the blood vessels again and spreads to various parts of the body, making its way into various bodily fluids like urine, cerebrospinal fluid, and synovial fluid of joints. Finally, the rubella virus has a cytopathic, or cell-damaging, effect that's linked to viral replication. This happens because the host body reacts to replication by causing apoptosis, or cell death, in infected cells, in an attempt to prevent the virus from spreading further. Another way that rubella can spread is from a pregnant female to her unborn child through the placenta. This causes congenital rubella syndrome in the fetus. In fact, rubella is among the most common infections that cause congenital defects in fetuses, which are grouped under the acronym TORCH. T stands for toxoplasmosis, O for other infections, like syphilis, R for rubella, C for cytomegalovirus, and H for herpes simplex. We're not exactly sure how rubella causes defects in the developing fetus, but it's possible that it causes vasculitis, or inflammation of blood vessels, which damages the vessels. As a result, there's not enough blood flow to developing organs, which can result in tissue death. It's also possible that the rubella virus slows down the process of mitosis, or cell division, in infected fetal cells. Since mitosis helps drive the development of the fetus, infected tissues might not grow properly. The timing of the infection in the mother will determine the risk of the fetus also getting congenital rubella. Congenital defects are much more common if the maternal infection happens between 4 weeks before and 20 weeks after conception. After 20 weeks, there usually aren't fetal defects, but there may be some intrauterine growth restriction, meaning the baby will be smaller than expected for their gestational age. The biggest risk factor for rubella is being unvaccinated, which is more common in countries with lower vaccination rates, and coming into contact with someone who is in the contagious period of their rubella infection, which starts about 3 days after being exposed to the virus and lasts around 3 to 4 weeks. Okay, now many rubella infections are asymptomatic, but when there are symptoms, they typically show up after a 14-day incubation period. Children tend to have fewer and milder symptoms that can last anywhere from 3 to 8 days on average. They'll usually have a low-grade fever and swelling of lymph nodes behind the ears and on the back of the head. A distinctive rash made up of little pink or light red bumps, or macules, can appear at the same time as, or a few days after, the onset of other symptoms. The macules start on the face and spread downward toward the trunk and limbs, and the rash typically clears up in about 3 days. Now, teenagers and adults who catch rubella are more likely to show symptoms and to be sick for longer. Females in this group are also more likely to get arthralgia and arthritis, or pain and inflammation in their joints, as a result of rubella. These joint issues can last for a month or sometimes even longer. Rubella in pregnancy increases the risk of miscarriage, fetal death, and stillbirth. Neonates born with congenital rubella syndrome commonly have a triad of symptoms: sensorineural hearing loss, or deafness, eye abnormalities like cataracts and retinopathy, or damage to the retina, and congenital heart disease like patent ductus arteriosus, which is when the blood vessel that connects the pulmonary artery to the aorta during fetal development fails to close after birth. They're also often born with dermal extramedullary hematopoiesis, which is when blood cells are formed in the skin rather than the bone marrow. Because it produces red or purple spots on the skin, it's commonly called blueberry muffin rash. Congenital rubella syndrome is also associated with intellectual disability, developmental delays, behavioral disorders, skin lesions, diabetes mellitus, and an enlarged liver and spleen, which is also called hepatosplenomegaly. Diagnosis of both postnatal and congenital rubella syndrome is confirmed by laboratory tests. It's usually done with enzyme immunoassay, which tests for rubella-specific antibodies, but it can also be done with polymerase chain reaction, which looks for viral RNA. Polymerase chain reaction can be used to test amniotic fluid, which is particularly useful for diagnosing in utero rubella infection. Now, there's no specific antiviral therapy for rubella, so treatment is supportive. With congenital rubella syndrome, treatment might involve surgery to correct congenital heart defects and screening newborns for hearing and vision issues. That said, prevention of rubella is done through a vaccine, which is a live attenuated immunization, essentially meaning it's been weakened. It's given between 12 and 15 months of age, and again between 4 and 6 years of age, and it has an impressive 97% vaccine efficacy rate, which means that out of 100 cases of rubella, for people that were previously unvaccinated, 97 would have been prevented by the vaccine. In addition to the vaccine, another source of protection for young infants is their mother's anti-rubella immunoglobulin, which the fetus gets transplacentally and lasts until about 12 months of age. Alright, as a quick recap, the rubella virus is a single-strand RNA virus of the togaviruses family. The virus first infects and replicates in mucous membrane cells of the nasopharynx, then does the same thing in the lymph nodes. Viral replication prompts apoptosis in infected cells. It's transmitted by respiratory droplets. Children are often asymptomatic or might have mild symptoms like fever, lymphadenopathy, and a rash, while adults tend to show symptoms and be sick longer. Rubella in pregnancy can be very serious for the fetus, resulting in congenital rubella syndrome. In addition to a blueberry muffin rash, classic symptoms of congenital rubella syndrome include deafness, eye abnormalities, and cardiac defects. Treatment for rubella is supportive, and prevention involves a live attenuated vaccine.